I originally had back pain that started about 20 years ago, and I went through a whole bunch of doctors, and they just told me I was getting old. I water skied my whole life. I was active my whole life. I'm just a healthy individual, and for someone to sit there and tell me that I'm getting old and that's just part of it, I just would not accept. I did acupuncture, found different chiropractors, and so that just led me to the journey of this kind of healing. My first chiropractor that I went to see, he had an x-ray of me that he was looking at, and he thought he saw something, but he never stated what it was, and he wanted to confirm it with another doctor, but he would never say. I even have a little bump on the side of my back that pops out, and no one ever said anything regarding it. They always said it was a tight muscle, and it's not, it's bone from the scoliosis. It was just recently diagnosed by my previous chiropractor who took x-rays and said, Denise, you have scoliosis. I was in so much pain, probably January of this year, that I was like, I need to do something, and surgery is not the way to go. Why do something so drastic to your body when it's not gonna fix it? I got on the internet, searched around, and one thing led to another, and I found Dr. Tony. I read his website, and it talked about adult scoliosis, and that was the first time I could actually sit there and say, that's me. Everything he wrote about, how your pain starts as an adult, how you didn't have it when you were younger. I was like, that's me. It was me to the T, and I just felt like this is the place I need to go.
Adult scoliosis is a completely different ballgame than adolescent scoliosis. And the main reason why is what's causing it to progress. Adolescent scoliosis is typically progressing because the patient is growing, and the growth factors are elongating, and this elongation typically doesn't lead to much pain or dysfunction in the person's body. So they don't really understand what's the big deal of this curve. In fact, I've seen kids as large as over 100-degree scoliosis. As the largest curve I've seen has been 155. These kids have had no pain, nothing. However, the opposite is true for adult scoliosis. When the minute somebody stops growing, what takes over as a progressive factor is now gravity, and gravity causes compression to the spine. This compression leads to compression of nerves and discs and all the tissues around the spine. This progression will always lead to pain in a matter of time. So even though it's very slow, maybe a half a degree or a degree a year, this slow progression is much more likely to create pain than progression as an adolescent.
The fact that he was in Kissimmee, we're only 30 minutes away, even better, and just coming and talking to him, so knowledgeable of everything. Everything he said when he looked at my x-rays made so much sense. He could see the progression, and he says it's crazy that nobody actually said something. To go from 31 to 24 in 4 days, I think is just outstanding. So I would expect some pain, and my body is fighting back, and I understand that. But I also know I'm healthy, that I should be able to handle it even better. When you have so much pain for so long and everybody says that there's nothing wrong with you, you start to think, am I making it up? And that kind of brought a lot of hope and peace back to me, because it's not in my head. He kind of proved it, and it's very obvious there on the x-rays.
For a 30-degree curve that has progressed that slowly, that's a tremendous amount of pushback, or what I like to say is kind of like almost like regeneration back into an earlier stage in her life. You start taking off 10 degrees off of scoliosis like this, you start going down 20 degrees from 32. I mean, if it's only progressing 1 degree a year, it's like turning down the spine back 12 years. But what curve is progressing even less than that, half a degree a year, it's returning it back 25 years, right? So it's pushing the spine back to where it was at this earlier stage in life when they weren't experiencing as much pain or discomfort. And that's what we were trying to do with most adult patients. We're not realistically getting their curve to zero, but we're just trying to turn their time back to when their spine was at a size that it wasn't causing the pain or discomfort that they're feeling at this point. Scoliosis is by far the most difficult spinal condition that exists. And because it's so difficult to deal with and it's so hard to manage, a lot of doctors don't even talk about it. They don't even talk about it with their patients. They don't even say that you have it until it becomes big enough to warrant an invasive, spine-altering, life-altering fusion where they put rods and screws in your spine, and it has high risks, especially associated even with an adult patient. So therefore, they pretty much tell these patients, well, you have scoliosis, but there's nothing we can do about it. Just wait for it to get worse. And when it gets bad enough, we'll put a rod in your spine. And so therefore, it destroys any hope of getting better. And actually, you're almost happy when you're told that your spine has gotten worse, bad enough, that now you qualify for surgery. I mean, I can't even imagine being told that. Let's just wait for you to get bad enough till we can put a whole rod in your spine and 20-something screws or something like that. So, of course, it's very deflating. And knowing that you have that there, and they ultimately know that this is what's causing, especially for somebody like Denise, causing pain and discomfort and things that they've been dealing with for years, if not decades. Like, what can you do to help my scoliosis? Why do I have to keep waiting for it to get bad enough to justify surgery?
I would say it's a very peaceful environment. Everybody is so welcoming and compassionate in your journey as you walk through it. But I will say coming here, it's been a lot of hope.